Enclomiphene citrate can be used with or without testosterone replacement. And this is something that's a bit misunderstood. So when you are trying to optimize your testosterone levels, and let's say you're a younger person, you can try enclomiphene citrate monotherapy. And I talked in another video about this before. Enclomiphene is different than clomiphene or Clomid. It is only the component enclomiphene and not the zooclomiphene, which is the second component that's contained in Clomid. Now, the zooclomiphene, that is actually an estrogen agonist, and that's something actually we're trying to avoid. The enclomiphene is an estrogen blocker, and how that works, again, is mostly it blocks estrogen receptors in your brain, telling your brain kind of there's not enough estrogen. And what does your brain do in that situation? It produces more FSH and LH, which then travel down to the testes and make more testosterone and increase sperm production, right? And so that's how that works. And it doesn't have, again, the zooclomiphene component, which we think is responsible for some of the side effects, including vision disturbances. So that's enclomiphene citrate, and it's a fairly new, not quite new, but newer medication, I would say. Now, it can also be used in conjunction with TRT. So first line in younger men, you can try enclomiphene citrate by itself to see if it sufficiently increases your total and free testosterone. And for many people, it does. In some cases, it can double it, it varies. It comes in 3 doses. There's 6.25, 12.5, and 25 milligrams. And it seems that most people do quite well with the 12.5 milligrams, either daily or every other day. But again, that's something you have to discuss with your prescriber, obviously. Again, long term, we don't have that much experience with it yet, since it is fairly new. We don't have studies over several years of someone being on there. And in that case, it's always a good idea once in a while to take a month off. And again, something to discuss with your provider. And also with many medications, when you take a month off, you kind of reset your body and you react more positively to it after that. Here also, it should not cause a dramatic decrease in testosterone. It's a slow decrease probably over that time, but it's not like we're giving it exogenously and then taking it away. So it's a bit different in this case. Now, the second option, of course, is someone that is on TRT. They might also benefit from it because it will preserve testicular function. So just like HCG, and I talked about that in other videos, can sometimes be given together with testosterone to preserve testicular function, to make spermatogenesis and testosterone production, enclomiphene is another option here. So when we think of HCG, or human chorionic gonadotropin, which needs to be injected, of course, that sometimes is given concurrently with testosterone. And what that does is it is an analog to LH, or luteinizing hormone. And it directly stimulates the testes to make more testosterone and to make more sperm again. So that means if someone is on an exogenous testosterone, on testosterone replacement therapy, injections or gel or whatever form it's given, your own production will slow down and actually will shut down, and there could be testicular atrophy. There could be severe, shutdown in the production, in your own production of it. And to prevent that, to allow fertility to continue to be there, and to actually allow some baseline testosterone production to be there in case at some point you stop the exogenous testosterone, given HCG, or human chorionic gonadotropin, was one of the options, and that would just continue that function, right? The other option is enclomiphene. And again, enclomiphene works not directly on testes, but it works on the brain. The brain then says, hey, I don't have enough estrogen. And again, it makes this LH in the pituitary that then travels down to the testes and has the same function. Now, it's really hard to compare these. I haven't seen a direct comparison between them in terms of efficacy. The advantage, of course, with enclomiphene is it's a tablet, and some people like that better. So there's no second shot in case you're on TRT. You don't have to do a second injection then, right? But both of them are options, and it's more commonly now combined. And again, they can both help to preserve this healthy production of sperm and of testosterone there. So I think there's good benefits. Now, then people will say, well, what about men that are kind of don't want to have further children? They don't really care about that. I always think you should preserve the function of any organ, including the testes. So when you are given an exogenous hormone and you're shutting that down, there can be other ramifications as well. So I think it's a simplified view to say the only function here is to make sperm or to make testosterone. And since we're given exogenous testosterone, we don't really care about the rest of it if that person if for them fertility is not an issue. I think that's a simplified view. Our bodies are much more complex than that. I think it's always good to preserve the function of any organ. And if you're giving one thing and you know that's going to shut down something else, to give something to counterbalance might be a good idea going forward. Yes, it's more expensive, obviously, and it's something that's a bit more cumbersome. But it's important to understand this, again, especially for younger men, where fertility definitely is an issue. And even if currently it's not, it might be in the future. And if you are on exogenous testosterone for a while, and this atrophy continues over that time, it might be very difficult to restart. Most men will be able to restart fertility once they stop the TRT, but I think it's good to try to preserve this while the therapy is ongoing. So just as an aside. Yeah, and again, for younger men, even HCG monotherapy has been tried, but less successful than Enclomiphene citrate. So if you're just looking for monotherapy for something to stimulate endogenous production, then I would say that the Enclomiphene citrate seems to be superior here. So just as something to discuss with your physician if you're going down that road. Other things, of course, to optimize your natural production of testosterone, especially free testosterone, are things like boron. And I talked about boron in other videos. Boron is a mineral, it's an element actually, that you can take as a supplement. Boron is very good at decreasing SHBG, or sex hormone binding globulin, which is really the protein that binds significantly to testosterone. And it's estimated that a maximum of 2% of your total testosterone is available in the form of free testosterone that does all the work that we think of when we think of testosterone, all the important things for muscle building, etc. Now, when you have too much of the sex hormone binding globulin, and this is a protein actually as we get older, as liver function declines, this is a protein, and this protein increases actually as we get older, which is not good for us, right? So then we're binding up all the testosterone. So some people, some men will have a very good total testosterone level. It might be 800 or so or more, but they have a very high SHBG binding up too much of that free testosterone. So they have very little free testosterone available. And boron can certainly help you. Now, you can overdose on it. It's a bit controversial still how much to take. In my opinion, you shouldn't take more than 10 milligrams daily. And of course, you have to discuss this with a treating physician and take a week off here and there as well, because you can overdose on boron. It's very rare, but it's possible. But studies have shown that boron has other benefits other than just decreasing SHBG. There might be some decreased incidence of cancer. For example, there was a population that had a naturally high level of boron in the drinking water. They had about 6 milligrams daily total coming in because it was in the water, compared to our current about 2 milligrams because we have overfarmed, or agriculture has overfarmed, and therefore we have less of this element available in the ground, right? So therefore, when we think of boron, I would say maximum of 10 milligrams, and again, take breaks here and there. That's another thing that we can certainly do to optimize these levels. Another thing that we should focus on is our intake of plastic chemicals. That means heating up things in plastic. That's certainly very bad because these chemicals are leaching into the food. We're talking about phthalates and bisphenols, which are hormone disruptors. That means the hormones that we have might not work very well, even if we have sufficient levels, right? And it can really cause a lot of problems there. So having less exposure to plastics and other chemicals that are in our environment, also, as well as pesticides and herbicides, we think of atrazine and others, which are heavily disrupting hormones as well. That is very important. Think also about synthetic clothing, contact with skin. That might be an issue as well, certainly if it's with workout clothing. And yes, these expensive brands like Lululemon and whatever, these are very synthetic. And yes, there are chemicals in there. And when we use them in close contact with skin, especially when we're sweating, there's cutaneous absorption of some of these plastic chemicals. Not the greatest thing in the world. So if you want to optimize all those things, wear more cotton, avoid also chemical sunscreens, avoid all these chemicals you're exposing yourself to, because that will also increase your own production and availability of your hormones. And that's for both men and women. It's very important to understand that. So yes, natural things should be done first, especially when you're younger. But if you are on testosterone replacement, these are the two options, Enclomiphene citrate or HCG. And I think both are valuable options. And it's important to understand these interactions and optimize your health and not shut down production of anything, especially if you're younger and fertility is an issue. So these are important things to consider for your health and fertility.